Hello everyone, this is Dr. Kurt Woeller here. I appreciate you joining me for this presentation. The title of this presentation is Immune Function in Autism, Understanding Important Therapies for Restoring Health. Let's go ahead and move on to the next slide. Before we get into the meat of the presentation, I just want to give some background information here. I've been doing these webinars now with Great Plains for a good 3-4 years. We cover a tremendous amount of topics with respects to biomedical intervention to autism. And I wanted to give you some additional information on different websites that I have. I'm huge into physician, healthcare practitioner, as well as parent education into what biomedical intervention for autism is all about. This particular website, autismrecoverytreatment.com, is a free information video blog website where I record video. They are transcribed into short articles and then posted on this site. So you can go to Autism Recovery Treatment to get some important information. I also have a very active subscription website. This is a subscription website that you can join on a monthly basis. There's no long-term contracts. You can discontinue it at any time. But it gives you access not only to treatment protocols, videos, past recorded webinars actually, articles, access to supplements, etc. But it also gives you access to me through a very interactive parent forum. You can message me privately if you choose, and you can dialogue with me through that website, ask questions, ask recommendations, second opinions, etc. And I can offer up my guidance and help through autismactionplan.com. Also, I've written a book, Autism, The Road to Recovery. This is an ebook, and you can access that at autismrecoverybook.com. And then many of the past webinars that I've recorded, actually re-recorded in professional format, very good audio along with access to the slides, can be accessed through this site here, autismseminarsondemand.com. Some people just like to get a copy of the slides, after the presentation, and these are downloadable through this site, and this covers a wide variety of topics, a few of those listed here. And then finally, if you want to get more information about me, my practice, my philosophy, links to books, links to seminars that I'm involved in, just go to drwoeller.com. There's actually a link on this site as well to my office website if you're interested in interacting with me more directly for your child or yourself with respects to questions and test interpretation, etc., related to biomedical intervention. Okay, so what are we going to get in tonight? This is an in-depth talk. This is a lot of intense material. However, I'm also going to keep it light on some end as well, because you can get lost into the nitty-gritty as far as immune system, immune chemistry goes, and it could be, a little bit wordy and overwhelming. So let's just keep it we'll keep it flowing. I also give a lot of information about various treatments, and we're going to talk about a few things here tonight. We're going to talk about transfer factor. We're going to talk about Immunovir, low-dose Naltrexone, which maybe you've heard about before. We'll touch on some different supplements that help the immune system, and we're going to end our conversation tonight therapeutically talking about GCMAF. Before we get into the treatment aspect per se, though, we need to lay down some groundwork with respects to how the immune system functions, and not that I'm expecting everybody here to remember everything about the immune system or become immunologists, but just have a basic understanding and a working knowledge. So if we look at this slide here, the derivation of blood cells, we notice there's a number of different blood cells that actually are measurable off of standard blood tests. If you have been to the lab and your child or yourself, for example, has done a complete blood count, it's called a complete blood count with differential, they actually look at platelets, erythrocytes, macrophages, neutrophils, eosinophils, mast cells. Some of that may seem familiar. You have to do more in-depth testing to start to look at B and T cell function, natural killer cell function, etc. Those are separate panels but these other markers here are very, very common. All right, so we're going to talk about the innate immune system and then the adaptive immune system. And, you know, let's go through a few basic things with respects to the innate immune system. And we won't go into this real in depth, but just to give you a working knowledge, there's actually 6 stages. There's chemicals that get released that help to then attract aspects of the immune system towards something that's gotten into the body, okay, whether it's a virus, a bacteria, a parasite, whatever it may be. Once that entity has been engaged, the immune system will work to engulf it. And when that pathogen has been engulfed, there are substances that get produced, hydrogen peroxide, for example, to try and kill it. And once, let's say, that bacteria has been killed, it's then digested, and the immune system digests it to get rid of it. And essentially, this happens on a daily basis with a multitude of things that we're exposed to. So the innate immune system is very much working all the time. Where we start to have problems is in what's called our adaptive immune system. And let me move something out of the way here. Okay, our adaptive immune system is involving a number of different cellular structures which we can actually test for. B cells, which are also called B-Lymphocytes, are part of what's called our humoral immune system. And these are things that produce the antibodies, the G, the M, the IgA, the IgE, and these are things that you can actually test through a standard blood test. Great Plains Laboratory actually has an immune deficiency panel that analyzes for different levels of antibodies. These are cells that come from the bone marrow, and they are then formed or deposited in various tissue throughout the body. Now, there's a sequence to how these antibodies are produced. We have something called IgM, which is actually the first antibody produced against an invading organism into the bloodstream. So it actually is acting in many respects as a first-line immune defense against something, you know, entering the body. We then have IgG, which is the second, or the second produced in a sequence of antibodies. It's also the most abundant, and this is the antibody that tends to give long-term immunity. This is what you would measure, let's say, a vaccine reaction to see if you've produced antibodies to a vaccine, or if your body's producing antibodies, let's say, to a virus. IgE antibodies are often elevated in allergic reactions. They are also helpful against fighting various parasitic infections like worms. And then we're going to talk a little bit shortly about IgA. IgA not only exists in the blood, but it also exists in the mucous membranes, and it helps protect against infections and allergens too, primarily within the surface lining of the digestive system, what's called the mucosal barrier. Now, T cells are also part of the adaptive immune system, and they fall under the category of what's called cell-mediated immunity. And there's 2 classes, CD4 and CD8. The CD4 are what's called the helper cells, and the CD8 are called the cytotoxic and suppressor cells. And we'll get more into that here shortly. So, in essence, T cells help to initiate the immune response of not only other T cells, but also B cells. And remember that B cells are what produce those antibodies we just talked about, IgG, IgA, and IgM. And then there's another subgroup of T cells called cytotoxic cells, and these are the guys that really can just kill stuff on their own. And then, like in anything in the immune system, we need a break. We need something to turn the immune system off or turn it down, because we don't want an immune system that is just running rampant without some control mechanism over it. Okay, well, let's break down our helper cells a little bit more. You've probably heard in the discussion of immune dysfunction in autism or chronic fatigue or cancer or other types of disorders, something related to what's called Th1 and Th2. And you notice that Th stands for helper. So the T helper 1, T helper 2. T helper 1 are the part of this immune system that tends to help fight viruses, fungus, protozoa, and it's the T helper 2 that is actually helping these B cells to make antibodies. And there needs to be a balance, so it's a set of scale approach. Okay, so there has to be a balance. One system regulates the other. You can't have one system getting too far out of sequence or you'll cause an imbalance in the immune system. A simple way of thinking of it, and it's simplistic. The immune system is obviously very complex, but the Th1 helps to direct an assault on an infected cell, while the Th2, in essence, is trying to stop the invasion in the first place. Okay? Th2 is also being driven with respects to allergic responses to foreign organisms or foreign substances coming into the body. So our immune system is working not only to prevent invasion, but also then deal with an invasion once it's occurred. Another part of this immune system response is something called natural killer cells. These are in their own category. They're not B cells, they're not T cells. They're part of this innate immune system, if you will, along with the other things that we mentioned in one of the first slides, and that is the white blood cells, the eosinophils. I apologize for this thing keep popping up. Neutrophils. We're going to talk at the end of the presentation specifically about things called macrophages and how that is related to this therapy called GCMAF. But essentially, natural killer cells naturally kill stuff all on their own. Okay, so they can go after cancer cells, they can go after cells that have been infected with a virus, for example. They help against bacterial and fungus infections. And essentially what they're doing is they're poking holes in the cell membrane to try to get at what's inside there. When you're talking about the immune system, there has to be a control sequence. There has to be something that's controlling the activity of all of these cells. And that chemical or chemicals is called cytokines. So cytokines are chemicals that are actually helping to control the immune response. And what are cytokines but small protein chemicals that are secreted by a variety of different immune cells, not only to help initiate an immune response and maybe maintain that immune response so it doesn't get short-ended, but also help to slow things down, help to turn things off, if you will. There's a couple types of cytokines which are most noted in immunology. One is interferons and the other is interleukins. Interleukins, or leukins, is for leukocytes, which are various aspects with respects to another name for a lot of the immune cells we're talking about. Interfere or interferons these are things that are often secreted in response to a viral infection. Interferon is a treatment, for example, for certain viruses like hepatitis C. If you've ever done an organic acid test from Great Plains, if it's in, the neurotransmitter section, you might find that the kynurenic acid is high. Now, kynurenic acid can be high if there's a B6 deficiency, but a lot of times it's high because of the immune system being engaged for one reason or another. And so whenever you see that, you can think of what may be happening is interferon being induced to a virus. What do cytokines do exactly? Well, they attract immune cells to the site of infection. They themselves can destroy stuff. They can mediate the immune response. They can stimulate these B cells to produce more antibodies. They can stimulate as well as turn off T cell activity. We've all experienced the symptoms of cytokines in our body if you've ever had a cold or a flu. The feeling of fever, fatigue, the lack of appetite, just not feeling well, the malaise, that is all a physiological response to various cytokines that are getting produced by the immune system against that virus. Now let's shift gears here and talk about what's called the mucosal barrier, the first line immune defense. Many individuals don't realize that the surface lining of the digestive tract is actually the largest immune organ in our body and one of the most important. And the mucosal barrier, or the intestinal lining, is bathed in mucus, and in that mucus is this particular antibody called Secretory IgA. Our body produces up to 10 grams of Secretory IgA daily. The actions of Secretory IgA are to help prevent against pathogens gaining access into the bloodstream. They can neutralize against viruses. They can try to inhibit, food proteins from getting in. So they play a wide role or a wide function in keeping us healthy. It's interesting that the antibody called IgA is the only immunoglobulin, another word for antibody, that does not work by eliciting an inflammatory response. So it has a regulating effect over the immune system, particularly in the digestive tract, but it's not initiating inflammation itself. One of the other roles of Secretory IgA is that it downregulates an immune response to a particular substance. And this is one of the reasons that as we come into the world as a newborn and then we start eating foods, etc., we start to develop an oral tolerance to the substances that we're being exposed to, so that our immune system's not reacting to everything that we're coming in contact with. The most common immune deficiency amongst anybody, whether it's kids on the spectrum, adults with other disorders, whatever, is a lack of production of Secretory IgA. Breastfeeding is critically important for helping to develop adequate passive immunity in the digestive tract, and is one of those early things that should be done to help promote the overall immune response in the gut, along with the Secretory IgA. Now, Secretory IgA is not only found in the gut, it's found in the genital tract, it's found in the oral cavity, the nasal cavity, up in the upper parts of the lung. So it covers a lot of that surface lining of our body, or those internal tubes of our body that are somewhat separated by the bloodstream. And then we know that it has a wide role amongst a number of different bacteria, viruses, etc. So ultimately, healthy gut function is the key to health, and it's also the key to the proper function of the entire immune system. Now, there are a number of supplements that can be helpful to promote a healthy production of Secretory IgA. And I want to preface this with the fact that, a supplement or a group of supplements should not be viewed as a magic bullet. It's not going to be, should be viewed as something that may necessarily do everything that we're looking for. These things are helpful, they are health promoting, but the aspects of what's going on in the digestive tract are complex. But these things are generally helpful in nature, not only in helping many times to reduce inflammation, but also to help bolster the healthy production of Secretory IgA. Curcumin is the active ingredient in turmeric, which is an Indian spice. It's been known to not only help inflammation in the bowel, but also just be a promoter of intestinal health overall, and it also helps to decrease inflammation throughout the body as well. So this particular supplement is available from New Beginnings Nutritionals. Couple other things that help in digestive health that I've used from time to time. A supplement called L-glutamine. L-glutamine is an amino acid that helps to bolster immune function and health of the intestinal lining. Usually a capsule or two a day has been helpful for a lot of people. A particular fiber product called True Fiber is nice. It's not only a fiber product to help improve bowel function, but it's also a prebiotic, which means it acts like a fertilizer for the healthy bacteria in the digestive tract. So no matter what kind of probiotic you're using, True Fiber helps to provide a fertilizer effect to those probiotics. Probiotics are critically important for the overall health of the digestive tract because they too also help to promote healthy production of secretory IgA. There's a combination product that's worthwhile to look at. You can go to a website called biomatrix1.com, and this product here called Support Mucosa is a combination of a number of things known to help bring health and heal the intestinal barrier. Glutamine, biotin, MSM, slippery elm, etc. It even has some turmeric in it. Now, every kid's unique, so not every child's going to be able to tolerate, every ingredient in these supplements. And so you as a parent, you as a caregiver need to look at these, supplements and say, is that something that they can take or that maybe you've known they've had a reaction to in the past? And in this, type of presentation, it's virtually impossible to go into all the different scenarios. There are people who have a concern about using too much glutamine because, excess glutamine reactivity in the brain can be an irritant to some neurologically sensitive kids. But that's not universal, and that doesn't happen with all of them. Also, these supplements shouldn't be viewed as something that would be overcoming a faulty diet or something that might be able to completely heal, true inflammatory bowel disease, which we certainly know that some kids have, diagnosed as autistic enterocolitis, which is actually it's very, very similar to Crohn's disease. You're not going to get much headway, from my experience, by if your child has true inflammatory bowel disease by just giving a little bit of turmeric. It's usually not going to be powerful enough. So, but these are some things that you can consider in trying to see if things might help. Now, there are a number of reasons for malabsorption. There can be autoimmune disorders, there can be infections, there can be blockages, there can be nervous system disorders, diabetes, etc. It turns out that gluten intolerance and furthermore celiac disease is one of the primary reasons for malabsorption in many people with chronic health problems. We certainly knew that gluten is a big problem for many kids on the spectrum because it essentially degrades the lining of the gut and causes, immune reactivity that can generate inflammation. If your child has been diagnosed celiac, they absolutely have to stay away from the gluten because what's happening is the gluten is triggering an immune assault against the cells of the digestive system. If your child is just diagnosed gluten sensitive, there still could be inflammation generated. It's not truly defined as an autoimmune disease at that part, but it still can be an aggravating factor. It still can disrupt gut function. A sampling of a blood chemistry along with an immune function analysis of antibodies from a normal diet, which means that these people with adult celiac were eating gluten, to a gluten-free diet. And we just look at the transformation in blood chemistry, how hemoglobin went up, how iron levels went up, how B12 levels went up, how the fat in the stool went down, means they were digesting their food better, and overall just a dramatic improvement just in changing diet. So we know that diet is a big part of the system. Well, if we look at the immune system, look at the digestive system a little bit closer, and we look at the surface lining of the gut, we notice these finger-like projections, okay? And we have these little blocks which can represent different cells. This might be a cell that's producing immune factors, antibodies. This might be a cell that's involved in digestion. These could be cells that are producing enzymes, etc. And then as we zoom in a little bit closer, we see one finger-like projection where you have these villi, these microvilli that line the surface lining of the gut. And those things are important to help move things along the lining of the gut. They also help with absorption, fat absorption, etc. And when we start talking about leaky gut, generally what's happening is these spaces in between cells start to break down. So basically with leaky gut is we've got bad stuff coming in that normally shouldn't be getting into the bloodstream, and that's what tends to create the allergic reactions, the inflammatory reactions that we see in so many kids, is this leaky gut, scenario. And that can happen because of infection. That can happen because of food allergies in the gut, gluten sensitivity, and any type of damage that's been occurring along the surface lining of the gut for a long time. So as we now come back and we look at the immune system a little bit more, we touch briefly just on the innate immune system, that immune system that just, acts in the moment when it needs to try to neutralize a pathogen or an allergen. And then the adaptive immune system, which involves the B cells to produce antibodies, the T cells that not only help to initiate further immune function, but also regulate the immune system more in depth with respect to viral infections, etc. And then our natural killer cells, which sort of roam and do their own thing. Well, if we start to look at the immune function a little bit more in trying to bring a balance, if you will, we can take this concept of Th1, T helper 1, T helper 2, and do some things to try to create more of a balance. Let's talk about that here briefly. So we know that the Th1 and the Th2 are specialized T cell populations that are geared by the chemicals in the immune system that tend to direct trafficking, and that these things have a wide sweeping effects against various pathogens, allergens, toxins. We know that Th1 produces chemicals that not only tell more T cells to get active, but they also produce chemicals that tell other T cells to just start killing stuff. Okay? An example of a Th1 response would be this chemical interferon, which I had mentioned before, is produced to help either combat cancer or prevent hepatitis C infection. It interferes with viral replication or interferes with cancer cell reproduction. Th2, on the other hand, is producing certain chemicals that are telling these B cells, hey, we need more antibodies. We need more IgG, or we need more IgA, or we need more IgE. So when a B cell produces an IgE chemical, that's what's giving us that typical allergic response, the itchy eyes, the runny nose, the cough, or reactions on the skin. Okay? So we then have to ask the question, what is it? Why would this system get out of balance one way or another? What is the control factor that controls a balance between Th1 and Th2? Well, it turns out that the chemical Secretory IgA, which we spent all this, this past 15, 20 minutes talking about, is the control switch over regulating the Th1, Th2 response, which then brings us back to that the gut function in general is the thing that is promoting health throughout the body and is regulating the immune function throughout the body as well. Excuse me a second, I just hit the wrong button. And I've lost my great. Let me get it back. There we go. Sorry about that. I know it's going to look weird on the recording. Okay, so we take it back to what's happening in the gut, and this is why the digestive system plays such a role. I mean, really not only in autism. I mean, geez, we see that in many other types of health disorders as well. And I'll admit, it's not an easy fix. You know, it's not as easy as just giving glutamine or you know, using, you know, turmeric. You know, things just don't magically disappear, unfortunately, because even the gut is not isolated to itself, and there's just multiple factors. But you know, the premise of biomedical and integrative medicine is you know, is if you can get the gut healed as best you can, then there's at least a hope and a chance that an individual can become less allergic, less inflamed, less susceptible to infections, etc. Well, what are some other things that help to modify this immune response, this balance between Th1 and Th2? Well, it turns out that oxidative stress causes a tremendous imbalance within the immune system, and that the chemical glutathione is one of the single most important protective and regulatory antioxidants in our cells. And we know that glutathione is often deficient in autism, as it is in other neurological disorders too. Well, research has actually shown that when glutathione levels drop, these cells called macrophages, okay, have a lower Th1 activity. Well, what's the problem there? Th1 is what's helping our immune system directly attack yeast, directly attack parasites, directly attack viruses. So if we're shutting off our Th1 response, guess what happens? Our immune system becomes imbalanced and we can't fight those chronic infections really well. And correspondingly, what happens is a rise in Th2. What is Th2 doing? Well, Th2 is telling our B cells to produce more antibodies. That's not necessarily a bad thing. The problem that can happen is when you have antibodies that are being produced and they are then complexing with different, you know, entities within the bloodstream or wherever they are, they can initiate inflammation. And you have too much of a production of antibodies, and let's say you have ongoing allergy, and allergy is also going to create inflammation. So glutathione is a very important remedy, or can be an important remedy, not only to help decrease oxidative stress, but it can be also useful to try to help bring some balance to the immune system. And glutathione comes in many forms: intravenous, oral, transdermal. This is just one example here. The lipoceutical glutathione that's available from New Beginnings. It's easily accessible. You can purchase it just as a supplement, and many kids respond very well to glutathione. We used to do, or a lot of doctors do, intravenous glutathione, which I really like. Unfortunately, it's not accessible to everybody, and so the lipoceutical form is not a bad way to go. You can also try precursors to glutathione. There's a supplement called N-acetylcysteine. The only downside to that is if a child has a really bad problem with yeast sensitivities, then sometimes those oral supplements that contain these sulfur compounds like cysteine can tend to aggravate the yeast. At least with the lipoceutical glutathione, it's something that tends to get absorbed pretty quickly. It's enveloped in a fatty substance, and so you don't get a lot of aggravation with yeast with the lipoceutical glutathione. So it's a nice supplement. I've seen some good response to it. Okay, well, let's shift gears a little bit and bring in another angle to this, and that is the aspect of chronic stress. We all have stress, so do our kids. And it turns out that physical stress, mental, emotional stress have the same impact on chemical production in the body. So it's just the multitude of stressors and how our nervous system and how our immune system is geared towards accepting it or maybe rejecting it. The bottom line I'm getting at here is that stress chemically is transmitted through the brain through the production of a chemical called ACTH. And ACTH tells our adrenal glands to output cortisol. Now, I've done presentations on this as well, and those are available online too. The adrenal glands are they're a gland that's linked to our entire hormonal system. And the adrenal glands put out cortisol. Cortisol has a regulating function over the immune system, controls inflammation, and a whole host of other things, which I'll show you here in a second. Normally what should happen is when our cortisol is produced, it'll feed back to the brain and say, okay, we're cool, we don't need any more cortisol. The problem is if you take this list and keep pumping in stress factors and keep telling the brain to output more and more and more ACTH, the adrenal glands never get a break, okay? And eventually, over time, the adrenal glands start to fatigue, and their output of cortisol becomes low or dysfunctional. Well, through that process, we have wide-sweeping effects on our body chemistry. We can, increase our potential for diabetes and heart disease, increase our potential for osteoporosis, breaking down our protein, creating hypertension, salt water retention, cardiovascular problems. And if you look over here at the right, this whole list of how that over time starts to really mess with our immune system. And we can have a whole host of disorders that come about because of what we call the chronic stress response. Well, why is this important with respect to this discussion as far as the immune system goes, Th1, Th2? Well, it turns out that continual stimulation of ACTH, as I mentioned before, over time causes cortisol depletion. Well, it turns out that one of the known chemical factors in our immune system that also is involved in this chronic stress response is a specific cytokine called interleukin-6. Interleukin-6 is often associated with AIDS and HIV, cancer, candidiasis, herpes viruses, and so what's happening is in the presence of these entities, whether it's cancer, chronic candida, various viruses, our interleukin-6 elevation can be, or levels can be high. Well, so this was just a research article showing that chronically elevated levels of interleukin-6 has been related to an increase in suicide attempt and the severity of symptoms that would lead to suicide. Well, it turns out that interleukin-6 actually stimulates the brain to produce more ACTH, okay, which then tells our adrenals to produce more and more cortisol. So now we have a link between the immune system, a chronic infection or something in the body, whether it's oxidative stress or toxins or whatever, that's inducing interleukin-6 to be elevated, and it's talking to the brain, which is then talking to the adrenals, which is then further worsening the situation as far as our brain and our immune system's ability to deal with inflammation and chronic infection. So this last sentence tends to sum it up. Interleukin-6, and by the way, interleukin-6 is one of these things called a pro-inflammatory cytokine, stimulates ACTH. ACTH is coming from the brain. We now then have a connection between the immune system and the brain, the pituitary, and the adrenals. And this is something that is clearly going on with children on the autism spectrum. There are a number of different companies that do salivary adrenal testing. And these are worthwhile panels to do if you can do them on your child. If you can actually get a saliva collection throughout the day through different samples to measure their cortisol levels throughout the day. A company called BioHealth, which I actually do some consulting work with, they have a panel called the 201 panel, which is looking at 4 different cortisol levels throughout the day. There's a saliva collection that takes place with that. And then another lab called Neuroscience that does some similar testing as well, These things do come with pediatric collection kits that for young kids, if they can't spit into a tube, they have to have some things to kind of swab up the saliva that can actually be used to analyze the cortisol. So the purpose of this is to assess cortisol output over a 24-hour period of time, and it gives a real-life assessment of adrenal function. The vast majority of kids on the spectrum that I've tested are low. They're either low normal or they have low cortisol throughout the day, which means that they have been under chronic adrenal stress for a long time, and their cortisol levels are dropping, and they've got adrenal insufficiency. Why is that important? Well, the bottom line is that the regulatory function over almost every aspect of our body, from the way that we process carbohydrates and fats, to the musculoskeletal system, to the way that our brain learns, the regulation of sleep and mood, to the control of inflammation, to the way our body detoxes and gets rid of toxins, whether it's heavy metals or internal toxins that are generated by metabolism. Our immune system is all linked to the balance of adrenal hormone function. So the adrenals have their hands in everything and appreciated of an aspect of how that might influence somebody's behavior and overall health. But we can now see how the adrenals can also be related, to the immune system as well. There are a wide variety of things that can be done for adrenal support. I'm not going to spend a lot of time going through all the adrenal aspects because we'll never be done. But there are a number of products that can be used as just general support to help support healthy cortisol levels. When you're dealing with kids, you want to avoid anything that contains DHEA in it. And so something like this here from Allergy Research is actually an adrenal cortex product that is, I've used that and been helpful. There's a product called Isocort, which is plant-derived cortisol, trying to help replenish low levels of cortisol that are detected off of a salivary adrenal test. So Isocort is something that you don't necessarily want to just use haphazardly. It's something that would be used in conjunction with actually evaluating cortisol levels through an adrenal test. However, something like the adrenal cortex product, it could be used. It could be used just as a support nutrient. I don't have a slide here, but I was going to tell you, New Beginnings actually has a general herbal remedy called Adrenal Essence, which is a nice blend of herbal herbs to help support adrenal function, and that's worthwhile looking at too. Okay, and then if there's additional questions you have, or you're looking for access to other more specialized supplements, that's something that members of my website autismactionplan.com have access to, so I can help you. I can help you access some of these things. Okay. Well, what are some other things that we can do to either evaluate for immune problems and intervene? There is an organization called SCIA, stands for Stop Calling It Autism. Stop Calling It Autism is a group that was founded a number of years ago that was looking at microglia activation with respect to brain inflammation and autism, and they actually have a protocol themselves that incorporates many of the same things with respects to diet and anti-inflammatory therapies. And this is just a list of different tests that the SCIA group advocates. The reason I put this up here is these tests are readily available either through Quest Diagnostics or LabCorp, which are the two most common sort of reference labs that are used by the vast majority of physicians. Whether they're a physician doing biomedical therapy or not, they're likely using Quest or LabCorp for their testing. And when you're looking at just a basic immune system evaluation, I always am going to do a complete blood count with a differential. and that can be done from LabCorp or Quest, and most any hospital clinics will do that. Anywhere in the world they'll do that. It's a good idea to look at vitamin D levels. Great Plains actually has a vitamin D test. Total immunoglobulins, again, you know, the IgG, the IgM, the IgA. Great Plains has a panel called an immune deficiency panel. The natural killer cell activity sometimes is hard to get. It is part of a panel that can many times be done by Quest or LabCorp. A lab called Neuroscience actually has a separate test kit for that. So if you go back here and you look at this panel here, where does it say natural killer cell functional assay, it's called, from Quest, or it's also called natural killer. It's called natural killer cell functional assay as well from LabCorp. So that'll help pick up the activity of the natural killer cells. If you're looking to do more specialized, you know, tests like the different interleukins, etc., you know, sometimes you have to go to some specialty labs for that. Honestly, many of those cytokines are very expensive, and they're not real cost effective, and unfortunately not readily available. Okay, if you want to get more specifics about the treatment protocol outlined by the Stop Calling It Autism group, just go to stopcallingitautism.org. I think it's worthwhile information. It's worth looking into. I do consulting work for parents that contact me. I've work with people who are around the world who are looking to implement this, and that's something I can help with as far as answering your questions and helping direct the process. Okay, we're getting near the end here, and we want to touch on some important therapies that you should know about. Transfer factor, Dose Naltrexone, and GCMAF. Transfer factor has been around a long time, and it comes as a supplement, and there's a lot of interesting functionality of transfer factor. It was discovered back in 1949. There's been many published scientific articles on the use of transfer factor. The way to think about transfer factor is essentially it's a chemical that is being transferred from the white blood cells of mom to her child. Essentially what's happening is the transfer factors are there to help educate the baby's immune system as they enter the world. Because there's many immunologists that actually believe that each microbe has some type of identifying code that's essentially cataloged by our immune system. And so when the mother is breastfeeding, she's passing on that immune history that she's incorporated over her lifetime towards her child through these transfer factors. Transfer factors are first delivered to the newborn through the breast milk colostrum. Colostrum, by the way, is a supplement you can actually take that does have some immune educating substances to it. In birds, they transfer factors through egg yolk. What do transfer factors do? Well, one of the things they do is they help to stimulate natural killer cell activity. And remember, the natural killer cells are what cruise the body looking for things to eat. Now, there's been some concern that because transfer factors may come from colostrum from cows as a supplement, that this could be a problem for kids on the spectrum. The ones that I use are gluten, casein-free, and specific carbohydrate diet legal. What's the dosing for transfer factors? It's not as though there's been an established dose per age or weight. I generally, start with any child who has, a lot of sensitivities. My general recommendation is start low and build up. In people with chronic fatigue, who've been suffering for many years, some people actually get fever, congestion, more fatigue when they start transfer factor because their immune system is being activated to start fighting virus. I don't see that kind of problem happen with the kids so much. I have seen it in some adult patients. So, if that's something that's more common in adults. Okay, well, how does this link back then to this whole Th1, Th2 discussion? Basically this, transfer factors have the ability to do a number of things. They can upregulate the immune system to help fight an infection. They can also downregulate the immune system to help in an autoimmune or an allergic type of situation. So they are really truly more considered immune modulators as opposed to something that's stimulating the immune system. So they're having a regulating effect over the immune system, and so they have a wide range of use, from a wide range of conditions, and they're a nice supplement, to have on hand. There are a number of companies that have transfer factors. I use products from a company called researchednutritionals.com. This is their standard transfer factor. One is regular, the other is mushroom-free. They don't have the Chinese mushrooms, the shiitake, the maitake mushrooms, which could be helpful for the immune system. Some people who are really, really yeast sensitive, or mushroom sensitive, they can use the mushroom-free version. And they're very, very nice. They're called multi-immune. These are the code numbers. Here's their website. Now, this is something that is not sold directly to the public. They do need to have a physician code. Again, people who are members of my the action plan site can have access to this. I can't give that code out, just through a lecture like this. However, any doctor can set up an account with Research Nutritionals, and they just have to contact them and set up an account, and they'll be given their own account number. New Beginnings actually does carry a few of their multi-immune products, so they may be able to be accessible there, although usually that has to be done with a special code as well. So there are some other transfer factors online that people have access to. So the general discussion really is about transfer factors. These are the things that I've used in my practice. So think about transfer factors as something that helps overall regulate the immune system. Okay. A couple of the things that come through the transfer factor products from a company like Research Nutritionals is a few other things that you can consider as maybe other remedies that could be helpful for immune function. Astragalus and something called beta-glucan are different natural remedies that the immune cells to help go after viruses. Green tea, for example, actually helps to promote more normal cell division in the body. A substance called IP6 helps to promote more healthy natural killer cell function. So many of the ingredients found in the Research Nutritional transfer factors have those additional remedies to just give more of a regulating effect on the immune system. Immunovir is another interesting product. This actually comes out of Canada, and it's something that's part of the SCIA protocol. What it does is it's a modulator of T cells. Again, like transfer factor, it helps to increase natural killer cell activity. And so you think about it with respect to particularly chronic viral infections. And I've seen a number of kids do quite well with this. I just had a consult recently where a child was doing Immunovir, and the parents really felt like there was an improvement in the child's language and their overall behavior. So the dosing recommendations, as these things come in tablets, you can see listed here. Again, this is not something that's just readily available off of a website for purchasing. It is something that has to be prescribed, but unfortunately we're in the realm now where sometimes there's only so much you can do on your own for immune functionality. There's certainly a lot of supplements that could be helpful, but these are things that you can talk to your doctor about as something that you might want to try with your child. So Immunovir is one of those remedies that's been well tolerated and very effective. Let's wrap up here with two therapies, low-dose naltrexone, and then we're going to finish up with GCMAF. Low-dose naltrexone has been around a long time. patients with rheumatoid arthritis. It also has some usefulness in Crohn's, some usefulness in MS, and certainly has been helpful for some kids on the autism spectrum. Essentially, low-dose naltrexone is a low dose of higher-dose naltrexone, which is generally used for heroin and morphine addicts. It's been used in autism at high dose to help with aggressive behavior. What we're talking about when you're talking about high doses, which is 50 to 100 milligrams a day or so, low dose, we're talking anywhere between 3 to 4.5 milligrams max dose. Generally, an adult would take a max dose of 4.5 milligrams once a day, and what it's doing is it's having a modulating effect over the immune system, particularly with respect to autoimmunity. And to just simplify it here, is it's having a regulating effect over the Th1 and the Th2 back towards the immune system, so that the immune system is being weighted so far to either side. And what it's doing is the naltrexone is actually causing a mild inhibition of these chemicals called endorphins. And as these endorphins are being inhibited, they're actually through the middle of the night as a corresponding increase in these endorphins, which is what's directing traffic with respects to the immune system. Low-dose naltrexone, from my experience, has been very safe. It's not addictive, and it's generally well tolerated. It comes in a capsule as well as a cream. So most of the compounding pharmacies can provide it in both forms. Usually the cream is dosed at a 3 milligram dose. The capsules, you can get them anywhere between, well, you can dose them at any strength really, but 1.5 to 3 to 4.5 milligram capsules. Most adults are taking 4.5 milligrams. Most kids are taking 3. The critical thing with low-dose naltrexone is it's taken between the hours of 9 p.m. at night and 2 a.m. in the morning. And that timing is important because it's that timing that has that overriding effect on these endorphins to get this corresponding increase in endorphin production throughout the night. If you try to do low-dose naltrexone during the day, it's just not going to have the same effect. The one thing that's important with respect to low-dose naltrexone is for kids on the autism spectrum is they should be gluten and casein free at least 30 days before trying it. In some cases, some kids who are really sensitive, when they take sensitive to gluten and casein, when they take low-dose naltrexone, can actually cause a bit of a withdrawal effect where they get agitated and irritable because their brain is so addicted, if you will, to the gluten and casein peptides. So you're going to generally see a better response if the kids are gluten and casein free. Optimal use is anywhere between 4 to 6 months, sometimes longer. Some of the positive changes that we've seen with low-dose naltrexone is better mood, improved language, socialization, and just parents reporting over time that their kids are less susceptible to illness. So if you want to look up low-dose naltrexone, you can just go to lowdosenaltrexone.org. Okay, GCMAF. This has been a hot topic, and it's been a useful intervention for some kids. The main website, which you can read about, is gcmaf.eu. This is going to have in-depth information about GCMAF therapy, and then there are links off that website to other websites too. Well, what is GCMAF? Essentially, it's a vitamin D binding protein. It was first researched back in 1996, and since that time, there's been a number of different scientific articles that have been released with respects to its ability to help rebuild the immune system. Now, its primary use has been in cancer therapy, particularly in helping to reduce tumors, but it also has beneficial influence on chronic infections such as viral infections as well. What is GCMAF doing in the body? And remember, this is a natural substance, okay? it's directing these cells called macrophages, and macrophages are designed to attack stuff. So it's directing macrophages to attack malignancies, cancer cells, or cells that have been infected with virus. It turns out that cancer cells and virus-infected cells, and it's turning out that there are other pathogens too that can do this, what they're doing is they're producing a chemical called nagalase. Nagalase essentially neutralizes the function of GCMAF in the body. And so the GCMAF is there to communicate with the macrophage to attack. The nagalase is inhibiting GCMAF, therefore there's no GCMAF to stimulate the macrophages. That's what's happening as far as what nagalase is doing. And you can do nagalase testing. There is a lab here in the United States called Health Diagnostics that does nagalase testing. There's a lab over in Europe too. And you can, it'll measure nagalase as nanomoles, milligrams, etc. And the reference range they mention here, 0.32 to 0.95. What we're typically seeing with kids, at least what I'm seeing, with kids on the autism spectrum is a level between 1.10 to 1.80. Some of the other adult patients with other types of disorders tend to have a lot higher levels. This particular patient who had a bone marrow disorder that is essentially pre-leukemic had a level of 3.80. The range of 1.10 to 1.80 is typical in my practice. That's where most of the kids are falling. The recommendation for GCMAF therapy is to attempt to get the levels down less than 0.62. You know, 0.62 to 0.65 would be great, but below 0.62 would be ideal. And at that level, it's felt that the nagalase is then released from its negative impact on GCMAF function. If you go back and you look to see what the lab range they're talking about is 0.95, that doesn't appear to be enough. The general feeling is you got to get the levels down around 0.62. Now, the GCMAF is actually given as an injection through a small insulin needle, and it's given once a week. Most cancer patients are doing a full dose, which is a full dose of 100 nanograms per ml, which, 100 nanograms 0.25 ml dose. So essentially they're taking a 25 unit dose once a week, and the 2.2 ml vial is going to last, at that dose, is going to last 8 weeks. Okay, for a lot of cancer patients, you know, who maybe have a stage 1, stage 2 cancer, they may be doing it upwards of, 24 to 36 months, 36 weeks. Stage 3, stage 4 could be doing it upwards of a year to year and a half. The goal is to try to get the nagalase level down to 0.62 or lower. Now, in some cancer patients, it's usually the later stage, it is actually being advocated to do the injections twice per week. The nice thing about GCMAF is it doesn't require a prescription. It's actually available through gcmaf.eu. In autism, the reports indicate that there are some improvements, sometimes seen within 4 to 6 weeks, improvement in language, improvement in attention, less obsessive compulsive behavior. The reality, though, is that kids need to use it a lot longer than just a couple weeks to see results. A typical starting dose for in autism, if we're doing it conservatively, and this really has to be based individually, if you have a child that's just very sensitive to supplements, to medications, then I personally would take it slower, even looking at 0.01 to 0.02 ml dose, which turns out to be 1 to 2 units to start, and then increasing it slowly. Is it going to take a little bit more time to go through things? Yes, but generally it's tend to see less problems. Other recommendations in some kids who tend to do pretty well with therapy, they're not real sensitive, starting at a 0.05 ml dose and increasing it by 0.02, 0.03 weekly seems fine. Usually the range is anywhere between 8 to 25. I realize that's a broad range. Again, it depends on the age of the individual and their tolerance of GCMAF. The one thing you have to remember is that GCMAF is a natural substance to our body, okay? But it will have a regulating effect on macrophages, which then start attacking cells that have been infected with virus or other pathogens. And from that, you can get an elicitation of immune response, which, in a really susceptible individual could cause behaviors, could cause them not to feel well, etc. On average, most kids are taking between 10 to 20 units per week as a maximum dose. The typical dosing regimen, between 20 to 24 weeks, some maybe being a little bit longer than that, and some maybe being less. So there's not a specific time frame, but more of a range of a time frame. There's really no toxic side effects from GCMAF itself, but you can have could be irritability, aggression, etc. Like any substance that you would be injecting into the body or taking orally, there's always the potential for an allergy, even though it's a natural substance to our body. That's just something to be aware of. Those types of situations are rare. A couple additional recommendations as far as supporting GCMAF therapy: optimizing vitamin D levels. Okay, and vitamin D being tested as the 25-OHD marker. Great Plains has a vitamin D test. Most labs will actually run a vitamin D test. Trying to get levels above 35. From an integrated medical standpoint, we'd like to see levels, upwards of 50 to 70. Seems to work really well. But the optimizing vitamin D is important with respects to the GCMAF because it's a vitamin D binding protein. Healthy diet is essential. You can override any of these therapies with a lousy diet. Okay, so I put in here paleo diet, just eating closer to nature, getting rid of a lot of processed foods, sugars, etc. Monitoring GCMAF therapy is important. Ideally, your child should have a baseline nagalase test and a baseline vitamin D and a baseline white blood cell looking at monocytes, which can actually be done through a test called a complete blood count. It can be done by any lab. And then every 8 weeks or so, trying to repeat the nagalase test to see where those levels are falling. Now, one thing about the nagalase testing, it takes about 5 weeks to get the test back. So it's not real expensive, but it just takes a while to get the report back. Okay, so that just needs to be taken into consideration. I actually, with many of the patients I work with now, I'll actually order them 2 or 3 nagalase test kits to have on hand, just so that when they're ready to do a blood test again, they have it ready to go. The general recommendations on vitamin D dosing, are about 1,000 to 2,000 IUs per 25 pounds body weight per day. That's essentially without knowing the level on blood testing. Ideally, getting a blood test to know where you are and monitoring it over time, is ideal. Wrapping up, there are a list of medications which will tend to inhibit GCMAF. And so to get, for example, ibuprofen can actually inhibit the functionality of GCMAF. To get an updated list on medications that should be avoided, go to gcmaf.eu through their website and they will list that. Again, as a wrap-up, if you have questions, if you have concerns, if you're looking to, a doctor to dialogue with, even whether you have a physician you're working with, but you just maybe like a chance to ask questions of somebody else. I do some, health answering health consultant questions through this website. You can post privately to me if you choose. If there's a link you want me to look at with respect to a supplement, whatever it may be, I can help people wherever they are in the world through this website with my experience and give my feedback on things. So autismactionplan.com. And then if you want to interact with me directly through private consultation, you can do my office. I do phone and Skype with people around the world. There's office consults as well. And you can learn more about me through drwoeller.com. If you'd like to get more direct information about consulting, you could do so through this email at mysunrisecenter.com or call 951-461-4800. So I hope this information was useful to you. I know it was a lot of information. We went through a lot of stuff here, and we did it in a pretty timely fashion. And we will talk next time. So everybody have a good day, and we will talk soon. Take care.